another PPP here. This is, the pre-patient procedures. We're going to go over packing cord today for when we do crowns. And so this is one I want you to pack 10 full case, one full case of packing cord 10 times before you can do it in the patient. And again, you have to come to me to pass it off. Once you feel like you can pack cord on this typhodont correctly, then I need you to come to me and show me under the pressure of that and have me pass it off, okay? So come back down here. Let me show you what we've got. We got a cord packer. We got the scissors, our cotton pliers, and this is our hemodent. This is where you keep the cords. Now I don't want you to use those, the soaked ones, but I got it out that when we're with the patient, that's where they are. I've already cut my own cord to do it, and we're going to do a posterior one today. So let me open this up. If you do anterior, canines are forward, then we have another color, black. Okay, so black we'll use for anterior. So an anterior tooth will go black and purple. Posterior tooth will go purple and then blue. Okay, they're just different thicknesses. So I've got a premolar tooth here that this is a thing I did back in dental school, and this tooth just has enough you can get around it. So I'm going to take the cord. So much easier on this typhodont in the mouth, and I'm sure you can imagine that. But I'm going to take the cord and kind of place it in there. Okay, so it stays. Now I'm going to turn it this way. When you're packing cord is just something you have to practice. It's not about how hard you push. Everyone look at me up here real quick. Everyone wants to push hard. It's not about how hard you push. It's about your angle and how you manipulate that cord. When you push it in, you want to push it and hold it a couple seconds and then out. That's how it stays. Everyone just jams and goes as fast as they can. It doesn't work. Push it in and hold it, and then go to the next one and kind of push it in. So come on in. I'll show you what I mean by all this. It's not about how hard I push down in there. It really is about... Oh, let me show you this tool again. This tool has different angles of these. So if you're working with this one and you can't find the right angle, switch it. You'll find it with this one. Between those two, you always can find the right angle. Okay, so come on back. So here's this tooth that's kind of been trimmed for a crown. We're going to start by, let's see, I'm going to get it to where you guys can see it. I'm going to get the edge of it. It's harder when it's not wet. I'm going to pull it tighter because when it's wet you can wrap it. Okay, you can take the edge of it and I'm going to push it down in there. Okay, I'm going to push it right in there. Now when I'm pushing against the tooth at, let's see, at that angle. I'm not pushing straight down the gums because what will happen is you'll slip and you'll go, oop, and you'll cut the gums. I guarantee you some of you are going to cut these gums on this typhodont. Okay, you're going to oop and cut it. It's at that angle, so you're pushing down in the gums. So, and it's hard. It's kind of weird on the typhodont. But see how that went down? I kind of just pushed it down in. Now, see the next bump? I'm going to actually just keep following. I'm going to push that bump in. Okay, and I'm going to hold it so it stays. Push it in and hold it. Okay, now on the top, I'm going to kind of come between the teeth and push it and hold it. Now a little trick there. See if you can get over the top, you guys. A little trick is to pull that tight. See when it's loose, how thick it is? When I pull it tight, see how thin it gets? So as I pull it tight, it makes it easier to kind of push it down in there. And I can actually pull it tight and wrap it around and just go to the back and push it there, and it usually falls in. Okay, so now I can kind of push it in. Okay, we're in there. Okay, so come on the back. Now we're on the back. I'm going to pull this string. I always like to kind of pull it around like that so it's in place. And I'm going to put that in there. I'm going to push it through there. It's not even close to the same on this typhodont, so you're going to have to learn a lot of this in the mouth. But you can learn the correct angles at least coming in there. See how I'm pulling? Now I'm going to pull that tight and come between and pull it in there. Okay, now we're coming back to the front. Now if you remember right, I started about right there. So I need to get this purple back to where I started, about there. Okay, so now that is where I started. I always got to remember where I started. So I'm going to take the scissors, and on the purple one, I'm going to pull that tight, and I'm going to trim right off where I started, and then we take the purple cord and finish it all the way in. So when you're done with the purple cord, go ahead and look around that. You cannot find the purple cord. It should go completely buried underneath. It should go completely buried underneath everywhere. Okay? So now when we've done that one, we're going to go ahead and take the blue cord, and we're going to put it in. I'm actually going to kind of put it between the teeth. And I'm going to pull it tight because on this Typhodon it's hard. And we're going to come in there. I'm just going to push it. See how I've pushed it in? I'm just kind of holding it there. See how it stayed after I held it? Push it and hold it, and it'll stay. Now I'm going to kind of push into that clump and push it the way I'm going. I'm pushing it that way. Okay? And there. Now I'm going to pull it tight. Get on top. Cameraman. I'm going to pull it tight and push in there. Pull it tight and push down there. Okay? Now I'm basically through. I'm going to come back through and kind of push again. But I'm basically done. By pulling it tight through the contact, you can get it. Okay, I'll turn it this way so the camera guys can see. I'm going to wrap it around again. And we're going to come that way. And if you notice, I have one finger on the end, and I do that in the mouth. I'll pull a lot. If I can't, then I just kind of push, or I'll push it with my finger that way. I like it to kind of wrap. And I'm pushing in. I'm going to change angles, push it in. I'm going to pull it tighter, push it. Push it because I'm at the contact. Push it. Okay. And I push it. Now I'm going to turn it just so you guys can see. Now we're back to the front. I'm going to push it. If you remember, I started in the middle. And bam. Okay, I'm done packing cord. Now with the blue one, you leave it out. The second cord you pack, you just leave it out. And then I take some gauze, 2x2, fold it in fours. I get 2 of them. 2x2, I fold it in half. Fold it in half again, and tell them to bite down. Okay? And they bite down on that, and it has to stay there a minimum of 5 minutes. So we set the timer for 5 minutes. Once it's been 5 minutes, you come get me. Sometimes I go a little longer. So it gives me the 5 to 10 minutes. I don't want to go longer than 10 minutes. So if I'm pushing 10 minutes, you come get me. I rarely do. That's one thing that I know I want to get there. Because if it's longer than 10 minutes, it can do some damage to the gum. So I rarely wait when we pack cord. 5 minutes I want to come in. At least 5, no longer than 10. Okay? Then we come in, and then I'll take it out, and we'll trim the teeth and take our impressions. Okay? That's it. Simple put for packing cord. All right. Good luck going packing.
Some bright morning when this life is over.